which have been published in the recent past, and they have looked at the factors which are important for weight loss, the adherence to these lifestyle interventions, and also the barriers to lifestyle interventions. And there are multiple factors which have been, thought to contribute to interventions getting into failure mode. There is adaptive response to weight loss, which promotes weight gain by increasing appetite and reducing the caloric expenditure. By virtue of weight loss, there is less body weight which needs to be taken care, so the total caloric expenditure goes down. In addition, body actually becomes more efficient, burns fewer calories to manage the same amount of body weight than a normal person. There are changes in the hormonal levels, changing the whole hormone milieu in a manner that it tends to favor weight gain rather than the weight loss. And we know from studies, experimental studies, which have shown that weight loss leads to increased levels of ghrelin, which promotes, increases hunger, and suppression of hormones, which actually induce appetite suppression. This is another, data analysis from National Health Survey from US, and they analyzed about 2,500 odd patients who had reported weight loss attempts with various, lifestyle interventions. And they showed that eating less fat actually gives you a chance of 37% chances of improving your weight or losing weight. Exercising alone, again, increases the chances of weight loss by 37%, more than 10% weight loss. But if you are using prescription medicines, the chances of weight loss are more than 2 times. Joining commercial weight loss programs increases the chances of more than 10% weight loss, but eating formula diets alone actually lowers the chances of weight loss. That was interesting finding here. This was a famous, trial with the sibutramine STORM study, where all the patients, whether in all the patients in STORM study were given VLCD for first 8 weeks, and then randomized to sibutramine continued use and intensive lifestyle interventions. Patients who were randomized to an intensive lifestyle intervention tended to regain weight. So failure of lifestyle interventions happens. So I mentioned about the 2 meta-analyses which looked at the barriers to lifestyle interventions and the factors which favor the effect of lifestyle interventions. So the important barriers that were identified in one of the meta-analyses was poor motivation, environmental, societal, and social pressures, lack of time to pursue lifestyle interventions, health and physical limitations, negative thoughts, negative moods, low moods are very important factor which cut down the lifestyle interventions, socioeconomic strains, gaps in knowledge, gaps in lack of understanding of the importance of lifestyle interventions. Most important predictors of adherence were early weight loss success, low baseline BMI, better baseline mood, and male gender. Another review of 19 studies showed that predictors of adherence were older age, higher education, healthier eating and physical activity behaviors, and higher initial weight loss. And poor predictors were depression, stress, bad mood, a strong body shape concern, more previous weight loss attempts, and being unemployed was one of the factors which actually was deterrent for following these. So is it just the lifestyle interventions that fail? Shashank, very cleverly talked about the benefits of bariatric surgery, but I'll show you one of the recent, prospective cross-sectional study with bariatric surgery, which followed up these patients. This is a small group but interesting study. 56 consecutive Roux-en-Y patients were recruited, divided into weight regain and weight stable cohorts. And they were also subjected to bariatric quality of life questionnaire. In 5 years, almost 20% weight gain. 5 to 10 years, more than 40% gain weight. By more than 10 years, more than 70% gain weight. And if you look at the weight regain group, average weight regain was about 45%. So it is not just the lifestyle intervention, even post-bariatric surgery, if you do not institute good lifestyle interventions, the patients are bound to gain weight. Just bariatric surgery is not sufficient to induce long-term remission of weight or obesity. Post-bariatric surgery, it is the lifestyle interventions, again, which will lead to the success story. So take home, intensive lifestyle interventions are effective in inducing remission in type 2 diabetes and also in prevention of diabetes. However, they are very difficult to implement. We have to understand, and attrition increases with passage of time. So education of patient and spending time with the patients and strong follow-up is what is recommended. Recently published preview study, the comments on this were that again, lifestyle change, however, is notoriously difficult to keep. Only 43% of the patients initially included in the preview study completed 3-year program, which was the important lifestyle intervention study. There is a popular quote that lifestyle interventions last only for 2 weeks and are very soluble in alcohol. Thank you. Thank you.